I need to tell you something that's been eating at me for years, and I know the moment I say it out loud, some of my colleagues are going to be pretty upset with me. But after more than 2 decades in medicine, after seeing what happens to people when they follow every recommendation thrown at them, I can no longer stay silent. Here's what almost no one wants to admit. Sometimes the worst thing you can do for your health is to get too many tests, especially after age 60 or 65. Right now, I can already hear some of you thinking, wait a second, isn't this doctor supposed to tell me to get checked for everything? Isn't prevention the whole point? And yes, that's exactly what we've all been told. Catch it early, find it before it becomes a problem, stay on top of everything. That's the message we hear everywhere. But what if I told you that message is leaving out the most important part of the story, the part about what happens after you find something? Because this is what those medical checkup commercials never mention. Once you find something, anything, even something that would never have harmed you, the wheels start turning, and sometimes those wheels roll right over your quality of life. So today, I'm going to walk you through 4 medical tests that I see causing more harm than good, especially for people over 60. I'm not doing this to scare you away from doctors. I'm doing it because I want you to understand exactly what you're getting into before you say yes to every test you're offered. Before we get into the specific tests, I need you to understand something that completely changed the way I practice medicine. It's called the cascade effect. Once you see it, you can't unsee it. Here's how it works. You go in for a screening test. You feel perfectly fine. You're living your life, doing your thing. The test comes back and shows something. Maybe a spot, maybe a shadow, maybe a number that's slightly off. That finding could be completely harmless. It could have been there for 20 years and could stay another 20 without ever bothering you. But here's the problem. The doctor sees it and now feels they have to do something about it. Because what if they don't and it turns out to be serious? So they refer you to a specialist. The specialist orders another, more detailed test. That test might show the same thing. Still unclear. So now we're talking biopsy, a procedure, maybe even surgery. And every one of those steps carries risks: infection, bleeding, complications, anxiety, lost time. And here's the most frustrating part. At the end of it all, 9 times out of 10, you discover it was nothing. It was never going to hurt you. But you've spent months worrying, undergone procedures, maybe had complications, and you're worse off than when you started, all because of a test you may never have needed. That's the cascade. It starts with a single test you probably didn't need in the first place. Let's talk about the first test I see triggering this over and over. This one is tricky because it sounds so smart, so modern, so preventive. I'm talking about full body scans, whole body MRIs or CT scans that promise to check everything at once. You've probably seen the ads. Come in, we'll scan you from head to toe. We'll catch anything before it becomes a problem. It sounds amazing, right? Like getting a complete picture of what's happening inside you. And I get it. The idea of knowing everything, of being in control, is incredibly appealing. But here's what happens in reality. Let's say you're 65, feeling great, active, no symptoms at all. You decide to get one of these scans just to be safe. You lie in the machine for 30 minutes, and a couple of days later, you get your results. Right there in the report, the radiologist mentions something: a small 3 mm nodule in your lung, about the size of a pencil eraser, or maybe a cyst in your kidney, or a spot on your liver. The report says, recommend follow-up imaging in 3 to 6 months. How do you feel in that moment? You walked in feeling healthy and walked out being told there's something in your body that needs watching. You probably can't think about anything else. Every deep breath reminds you of that lung nodule. Every twinge in your side makes you think about the kidney cyst. So 3 months later, you go back for another scan. Maybe the thing is still there. Maybe it looks a tiny bit bigger. Hard to tell. The radiologist recommends seeing a specialist. The specialist wants to be thorough, so they recommend a biopsy. And a biopsy is no small thing. It means anesthesia. It means putting a needle into your lung, kidney, or wherever this finding is. It means risk of infection, risk of bleeding. Research shows that when healthy people over 60 get these full-body scans, something unusual is found in almost everyone. I'm not exaggerating. 90 to 95% of people. Tiny spots, small cysts, little shadows. The medical term for these is incidentalomas, things found by accident. The vast majority, by far, never cause a problem. They're just part of having a body that's been around for 6 or 7 decades. They're like internal wrinkles. But once we find them, we can't ignore them. And that's when the cascade begins. There is actual research on this. They followed people who got full body scans, and you know what they found? The people who got scanned did not live longer than those who didn't. They didn't prevent any disease, but they did have significantly higher rates of anxiety, depression, and unnecessary procedures. The scans didn't make them healthier, they made them sicker. So what should you do instead? This is important because I'm not saying ignore your health. I'm saying focus on the right things. Instead of imaging your insides, pay attention to how your body actually functions. Can you climb 2 flights of stairs without getting winded? Can you stand up from a chair without using your hands? How's your balance? How's your sleep? These functional measures tell us far more about your health than any scan. If you want a real health checkup, sit down with a doctor who takes the time to go through every medication you're on, because I guarantee at least one is probably doing more harm than good. Someone who talks to you about your diet, your activity level, your social connections. Because those every day, even boring things, are what really determine how healthy you are. A scan hunts for problems that may not exist. A functional assessment optimizes the health you already have. Big difference. Next, the second test. This one affects a lot of people because it taps into the fear we all have about aging. Getting a brain MRI for mild memory concerns. Here's the typical scenario. You're a little over 70 and you've noticed you sometimes can't recall the name of an actor you like, or you walk into a room and forget why. Normal things, the kind of thing that happens to everyone as they age. But maybe your kids are worried, maybe they've heard about Alzheimer's and they're scared, so they push you to get a brain scan just to check. I understand that fear. No one wants to think about losing their memory, losing themselves. But I need you to understand this. Getting a brain MRI for mild forgetfulness is almost never helpful and is frequently harmful. Here's what happens. You get the MRI, and a few days later, you're sitting with your doctor reading the report. The report says things like mild cerebral atrophy, age-related changes, white matter lesions, small vessel disease. Those words sound terrifying, like your brain is falling apart. But here's the truth. Those findings are completely normal for someone in their 70s. They're describing what every brain looks like at that age. It's like scanning your skin and being shocked that it shows wrinkles and age spots. Of course it does. That's what skin looks like at 75. The problem is, those medical terms don't sound normal. They sound like disease. Suddenly, you're walking around thinking you have brain damage, thinking Alzheimer's is right around the corner, even though you're doing fine. And here's the really frustrating part. Studies show that when you scan the brains of healthy people over 75, more than 90% have findings that look abnormal on the report. More than 90%. Yet most of those people have perfectly normal memory and thinking. The pictures don't match reality. I've seen razor-sharp people reading books, managing their finances, doing crosswords whose MRIs look awful, and I've seen people with early dementia whose MRIs look pretty normal. The image doesn't tell us what we think it does. So what should you do instead? If you're worried about memory, there's a much better way to check it. There are simple office tests that take about 10 minutes. We ask you to remember 3 words, draw a clock, count backward from 100 by sevens. Simple things that actually measure how your brain is functioning, not just how it looks. And if those tests show a problem, then we start looking for causes. Here's the key. Most causes of memory issues in older adults are reversible. It could be a medication causing confusion, low vitamin B12, depression, which often shows up as memory problems in older people, sleep apnea cutting off oxygen to your brain at night, or a thyroid issue. We check all those first, and you'd be surprised how often fixing just one brings the memory back. No MRI needed. We're looking at function, not pictures. We're treating the person, not the image. Now, if someone is getting steadily worse, if they're getting lost in familiar places, can't manage their money anymore, that's different. Then we need a full evaluation, including imaging. But for the everyday forgetfulness that comes with age, an MRI creates more problems than it solves. The third test on my list surprises people because it seems so logical. Routine cardiac stress tests, putting someone on a treadmill just because they've reached a certain age. Typical situation, you're 72 and you're scheduled for routine surgery. Nothing major, maybe a hernia repair or knee replacement. The hospital protocol says everyone over 70 needs a cardiac stress test beforehand. So even though you feel great, even though you can walk a couple of miles without chest pain or shortness of breath, they put you on a treadmill. Think about this for a second. If you can walk 2 miles in daily life with no problem, what exactly is the treadmill test going to tell us that we don't already know? Your daily life is your stress test, you're passing it every day, but protocol is protocol, so you get on the treadmill. And here's where it gets messy. Stress tests have a very high rate of false positives in older adults. That means the test says something is wrong when it isn't. It could be because your heart rate doesn't climb the way it used to, because of medications, or for 100 other reasons that have nothing to do with dangerous blockage. But once that test comes back abnormal, you're on the medical conveyor belt. They schedule a cardiac catheterization, where they thread a tube through an artery to your heart to look at the vessels. It's invasive, it has risks, and very often they find exactly what you'd expect in a 72-year-old heart: some plaque buildup, some narrowing, but nothing that needs a stent or bypass, nothing about to cause a heart attack. But now you've gone through an invasive procedure, and worse, you've been labeled a cardiac patient. They load you up with new medications, and the psychological damage is done. Maybe you used to play tennis, but now you're afraid to exert yourself. The test that was supposed to protect you has stolen your confidence and your activities. So what's the alternative? Listen to your body. That's the best stress test there is. If you can climb stairs, walk at a good pace, do your normal activities without chest pain or excessive shortness of breath, your heart is telling you it's fine. Those are the symptoms to watch: chest discomfort with exertion, unusual breathlessness, dizziness. If you have those, yes, absolutely get checked. That's when a stress test makes sense. But if you're trying to know your future risk, there's a much better tool: a coronary calcium score. It's a quick CT scan, 5 minutes, no treadmill, no needles, very low radiation. It measures how much calcium, hardened cholesterol, is in your arteries. You get a number. A 0 means very low risk of heart attack in the coming years. A high number means you need to get serious about prevention through diet, exercise, maybe medication. The key difference: the calcium score tells you your risk and guides prevention. It doesn't automatically send you down the path of invasive procedures. It gives you information so you can make decisions, not anxiety that forces you into procedures. Don't let them put you on a treadmill just because of your age. Trust what your body is already telling you every day. Now we come to the fourth test, and I know this one will be controversial. Routine screening colonoscopies after age 75, specifically when previous ones were normal and you have no special risk factors. Let me be very clear. I'm not against colonoscopies. They're a fantastic tool. I recommend them starting at 45 or 50. They prevent colon cancer by letting us remove polyps before they turn into cancer. If you're 50, 60, or even early 70s and it's time for one, please get it. But here's the thing: every medical test is a balance of benefit versus risk, and that balance shifts as we age. The benefit of a colonoscopy is preventing a cancer that, if it develops, takes 5 to 10 years to cause problems. But if you're 78 or 80, does that benefit still outweigh the risks? Because colonoscopies do have risks, and those risks increase with age. There's the bowel prep, that awful liquid that keeps you in the bathroom all night, which can leave an older person dehydrated and weak. There's the sedation, which carries higher risk of confusion or breathing problems in older adults. And the biggest one, the one that keeps doctors up at night, is perforation, a tear in the colon wall. As we age, the colon wall thins. The risk that the scope accidentally tears it roughly doubles or triples after age 75. A perforation is a surgical emergency. It often means emergency surgery. Sometimes it ends with a colostomy bag. For an 80-year-old, that kind of operation can mean the end of independent living. Now weigh that against the benefit. You're trying to prevent a cancer that would take years to become a problem. If your life expectancy is less than 10 years, the math doesn't add up. You're more likely to be harmed by the colonoscopy than saved by it. That's why most medical guidelines now say to stop routine screening somewhere between 75 and 85. This isn't one size fits all. If you have a family history of colon cancer, previous polyps, or inflammatory bowel disease, the calculation is different. But for the average person with no special risks, continuing colonoscopies every 5 or 10 years past 80 is probably doing more harm than good. So what do you do instead? Ignore your colon completely? Absolutely not. You shift from invasive screening to smart surveillance. First, pay attention to symptoms. This is crucial. If you notice persistent changes in bowel habits, blood in the stool, unexplained abdominal pain, weight loss, or anemia, those are red flags. Age doesn't matter then. You need a colonoscopy to find out what's going on. Second, use the power of diet. This is huge. The best thing you can do for your colon is eat fiber, fruits, vegetables, legumes, whole grains. Fiber feeds the good gut bacteria, and those bacteria produce compounds that protect against inflammation and cancer. Eat more lentils, more broccoli, more oats, more apples. That's prevention that benefits your whole body with zero risk. The message is, get colonoscopies when they make sense, up through the early 70s. After that, for most people, it's time to focus on watching for symptoms and eating the right foods. So there you have it. 4 tests I see causing more harm than good, especially after 60. Full body scans that find problems that aren't problems. Brain MRIs for normal age-related forgetfulness that create abnormal anxiety. Routine stress tests that trigger cascades of procedures. And colonoscopies after 75 that risk more than they prevent. Notice the pattern? It all comes down to the cascade. One test leads to another, which leads to a procedure, which can lead to a complication. And somewhere along the way, we forget to ask the most important question. Is this person actually better off? Because this is what I've learned in over 20 years of medicine. Health isn't about having perfect test results. Health is about function. It's about being able to do the things you want to do. It's about enjoying your grandchildren, going for walks, reading books, living your life without unnecessary fear or medical interference. The goal at 65, 70, or 80 isn't just to live longer, it's to live better, with independence, dignity, and joy. And sometimes the best way to protect that is to say no to a test that will pull you into a maze you don't need to enter. I'm not saying avoid all medical care. I'm saying be a smart patient. Ask questions. When a doctor recommends a test, ask why. Ask what happens if it finds something. Ask about the risks. Ask if there's an alternative. Then make a decision based on what matters to you. You're in charge of your health, not the protocols, not the computer reminders, not the clinical guidelines. You. The more you understand what you're agreeing to, the better decisions you'll make. If this information was helpful, if it made you think differently about medical tests, please share it with someone who might benefit from hearing it. And tell me in the comments, have you ever felt pushed into a medical test that didn't feel right to you? I read every comment and learned from your experiences just as you learned from mine. Thanks for watching. Take care of yourselves, and remember that sometimes the healthiest thing you can do is nothing.